Okay, 5, 4, 3. Hi, good afternoon, everyone. My name's Steve Killen. I'm the Transformation Director for University Hospitals Dorset, and I wanted to welcome you to our session, Investing in Our Hospitals. So thank you for joining us. It's myself and my colleague, Dr. Isabel Smith, are going to take you through about the next 30 to 35 minutes. We're going to share a few videos with you and hopefully take some questions at the end. I'm going to move us on to what our agenda is going to be. So we're going to do a few introductions. Well, I'll introduce Isabel. She'll introduce herself in a second when we come to it. We're going to describe our local plans. We're going to do a bit of a preview of our new facilities that are opening at Poole and Bournemouth. Going to share a few facts and figures with you about what's happening across our two sites and how that links in with our wider story across Dorset. Then we're going to finish up with some of the innovation challenges that we're facing and how we're kind of addressing those at University Hospitals Dorset, and summarise with questions. So moving on. Dorset. So we've got a bit of a wicked problem. Similar to many areas, we have got a mix of some older people in our area, so we've got an elderly population, probably more so than many of our other areas across the UK. We've got some financial challenges that we know about and financial pressures that are faced across the NHS. We have workforce challenges and a shortage of great staff. We do have amazing staff, but we have a shortage. And then we have the rural and urban challenges. And we have one CCG, so that's the Clinical Commissioning Group. We've got one community and mental health provider. We've got our two acute providers, which is the two hospital providers, that's University Hospitals Dorset and Dorset County Hospital. And then our two local authorities now, which is BCP and Dorset Council. In terms of our engagement, we've been driving towards a whole load of change and trying to improve our healthcare services. And we've had 3 years of public and patient and staff engagement around something called our Dorset Clinical Services Review. That gave us the opportunity, led by the CCG, to make a decision to change our services, and that was supported by both the Joint Health and Scrutiny Committee in Dorset, but also we went through an extensive review through both a judicial review through the courts, as well as an independent panel review, and then finally approval by the Secretary of State, who endorsed the decisions that we were making to change our hospital services. And that's really the bedrock of what we're going to describe today. So the overall vision and aim for Dorset was to ensure safe, high quality, sustainable care by implementing Dorset's Clinical Services Review. And for us in University Hospitals Dorset, that was about delivery of a major planned and a major emergency hospital. We were going to draw down the money from the Department of Health and Treasury to enable us to do that, and also engage patients and staff on the way as we deliver new clinical models, as we engage and talk about cost-effective ways of kind of crossing those traditional organisational boundaries that we might have once had. So we've worked through, we know that we want to change our hospitals, and we've worked through our design process. So it's been a really well attended session. We've had over 12,500 clinical hours where our teams have given up their time to come and look at how we design and change our pathways as we move into new ways of working. We've had some great ideas about how we might transform those. It's been frustrating at times as we've had to go back and rework things because we necessarily haven't had the money, or we've had to think things through. But it's been owned by our staff, and our staff have gone through these iterations again, and actually it's been a really engaging and good fun session. At the end of it, we've ended up with over 1,600 drawings worth of new design across our Bournemouth and Poole sites, and that's kind of testament to where we are now, and we'll talk about those in a moment. I'm going to hand over to Isabel now, and Isabel's going to kind of talk us through the clinically led programme that we've had.
Thanks, Steve. So as Steve has described, our existing services have really evolved over the years within our sites. And although we have many brilliant services, they don't always work together well in pathways that serve our patients in the most effective way. We also have workforce challenges, which could be improved by co-locating some of the duplicated services and separating emergency and planned care. And this is one of our 5 key strategic objectives for our trust, as Debbie described this morning, and for our integrated care system, as well as nationally. Our merger last year has helped us to work even more collaboratively to bring together the expertise within the organisations to really build on the best of both in our transformation plans. Of course, the pandemic has been and continues to be a challenge. I'm one of the consultant anaesthetists, as well as being medical director working in the transformation team. And we've all really been challenged in the last couple of years to redevelop our plans where necessary to follow local and national infection control guidance and ensure that our new builds are really designed appropriately and we're keeping up with everything that changes. If you just move to the next slide, Steve. So just pop on the next slide, thank you. So these graphics are a taster of the things to come. So on the left is our new maternity, children's, critical care and emergency department at Bournemouth. And on the right is our new theatre complex at Poole. And we're going to show you some more detail of these later in the talk. Next slide, please. So Bournemouth site is going to be our major emergency centre. And this will have a larger emergency department, much bigger than both existing departments combined, a critical care where we treat our sickest patients, and then the new maternity and children's unit. And moving all the emergency and sickest patients to one site will mean that patients have access to the expertise they need from the full range of the multidisciplinary team. So this is the nurses, the doctors, and all the allied health professionals 24/7, as well as full support from our pathology hub and all the other support services. So we're now working on creating the clinical pathways for this care, having designed the building work. If you move to the next slide, we're going to show a video now, which will show you through the development at Bournemouth over the next few years.
Dr. Isabel Smith, and I'm a consultant anaesthetist and medical director for strategy and transformation at University Hospitals Dorset. This brief animation shows the development of the maternity, children's, emergency and critical care unit at Royal Bournemouth Hospital site over the next 5 years. The work also includes ward refurbishments, a multi-storey car extension and a new pathology hub, as well as upgrades to energy, IT and other infrastructure. Between January and October 2021, we started the process of creating the new road alignment and establishing the compound. The plaza and public areas around the hospital will change to improve the experience for patients, carers and our community. From November 2021, we moved on to the road layout, creating a one-way system around the hospital and compound, which will remain in place for the 3 years of construction. You can start to see the clearance of the main site and then the piling rigs and the cranes going into place. To give an idea of the scale of this development, the main new build extension will be 22,650 square metres, equivalent to 115 tennis courts. The project is part of an overall £250 million reorganisation of NHS services across Dorset, which will see Royal Bournemouth Hospital becoming the centre for emergency care, whilst at the same time, Poole Hospital becomes the main centre for planned care in East Dorset. As the timeline continues, we see the building is finished externally from spring 2023, and then we move to internal fit-out. From autumn 2023 to summer 2024, it's internal and external finishing. The Trust takes possession from summer 2024, with final roadworks and landscaping finishing in September 2024. There will also be road and cycle access improvements across the site. In summary, it will put our health services at the cutting edge of care in a once-in-a-generation investment. For more information on this exciting development, visit the Investing in Our Hospitals section of our University Hospitals Dorset website.
Thank you. We're going to pass back to Steve now.
Okay.
Hi, my name's Jen and I'm a nurse, a sister in the emergency department.
Sorry.
I've been a nurse for nearly 20 years, as well as looking after...
Apologies, joys of YouTube. Okay, sorry, I was just introducing Dr. Farhad Islam. So Dr. Farhad Islam is one of our emergency department consultants based at Bournemouth, but also works across the air ambulance, and is part of the team that is going to just talk through some of the changes that are happening in our new emergency department on the Bournemouth site. So I'll just play this video again, and we will go to not how to do the recovery position. This one. Here we go.
Hello, I'm Dr. Farhad Islam. I'm a consultant in the emergency department at University Hospitals Dorset.
It's really exciting for all our staff to now see that the enabling works have already started to create the new access road for the site. This brief animation shows how we plan to develop the new emergency department at the Royal Bournemouth Hospital site. This is part of the major £250 million transformation of our services at University Hospitals Dorset, including developing a 24/7 urgent treatment centre at Poole Hospital. These changes have been planned over the last 4 years with regular input from local clinicians and the public, contributing to designing a state-of-the-art bespoke modern emergency department. This conforms to new national standards fit for the future needs of our local population in East Dorset and beyond. We start with a view of the covered ambulance drop-off area, moving towards the ambulance entrance of our new emergency department. This will be larger in size than both the existing departments at Poole and Royal Bournemouth put together, and will include an expanded resus area with direct access to adjacent CT scanning facilities. This will facilitate timely diagnosis for some of the sickest patients that present to our new ED. As we move into the building, you can see the nurse streaming desk used to direct ambulance teams to the correct location, and then through the doors into the resuscitation area. This area has 8 large resus cubicles with 2 paediatric enabled rooms immediately adjacent to the new paediatric emergency department and urgent treatment centre. Each resus bay is double the size of our current resus bays and have access to the near patient testing facility provided for quick point of care diagnostic tests. There's also access to a medicines management room, near patient testing, as well as additional toilet facilities. Moving out of resus, we're now in one of the main arterial corridors, with the CT scanners directly opposite to resus and patient relative rooms passing on the right. You can also see the ambulance crew restroom in this area. We're now in the Rapid Access to Treatment area, or RATS for short. This base contains 7 clinical trolley spaces and 4 chair spaces. This will be a very busy area where initial decisions are made on patient condition by senior clinicians and patients sufficiently managed by multidisciplinary teams to ensure rapid and appropriate tests are ordered and initial treatments are commenced. You can also see what's known as a dirty utility room, an essential space to safely dispose of clinical waste and laundry. We're now moving out of RATS and back into the main arterial corridor. Again, you can see access doors to the right to various staff facilities, including flexible offices and a simulation training facility for all ED staff, washrooms and the new ED staff room. We now exit the building via one of the fire escapes to get another view of the exterior environment. Outside, you can see more ambulance and emergency vehicle parking before we loop back to the view of the new building facade. For more information on this development and the future plans for Royal Bournemouth Hospital, visit the Investing in Our Hospitals section of our website.
Okay, so that was Izzy talking about our new emergency department and gives you a taste of what we can expect. I think I also just wanted to share the scale of what we're kind of taking on in University Hospitals Dorset. And I'm going to put these up and give people a minute to kind of look over those, and then maybe a few questions about them later on. But there's some fascinating numbers in here in terms of benefits. So 33,000 ED attendances will be seen by a consultant that is not currently seen by an ED consultant across our 2 sites. Up to another 21 lives will be saved each year by cardiology changes alone. And then if we come on to some of the kind of scale of this, the maternity unit is going to be the size of St. Paul's Cathedral. We'll have 120 new beds on the site. We'll have 6,000 planned care operations with reduced waits. And then there's a couple of kind of factual numbers for people to get interested in. Over 2,000 tonnes of steel, 10,500 cubic meters of concrete going into this development across the site. So it's a massive investment, of both people's time, significant benefits for our local economy, and actually it's a great programme to be part of, and I'm thrilled to be part of it as the transformation team. I'm going to move on then to our kind of roadmap. So this just gives a taste of the next 4 or 5 years really, and it shows that we start right back in 21 as we are with some enabling kind of decants, as we call them. That's the opportunity to free up the site where we start a bit of work. Then we start building our theatres at Poole, and anyone who's been to the Poole site recently will have seen our tower crane go up over the summer. Then we start moving into new builds at the Royal Bournemouth site in early 2022. We get into our pathology hub. We then get into additional wards that come online in the Bournemouth site to enable the opening of the new emergency site. We aim to complete that Bournemouth site around kind of mid-24. Poole theatres will finally open phases B and C. There's a number of phases where theatres come online at different times. So the early theatres will come online in 2023, and the second part will come online in 2025. And then we'll move to kind of having created all that space. Poole in 2026 will become our community beds and our corporate facilities. So there's a real trajectory and a real sense of enthusiasm about the journey that we're going on. I'm going to hand back to Isabel now, who's going to talk about the Poole sites.
Thanks, Steve. So Poole will be our major planned care centre. So that is all the planned operations such as your hip and knee replacements, breast cancer surgery, and many other surgeries. There's also going to be expanded outpatient, cancer and diagnostic services, and this will enable efficient pathways of care which are less disrupted by the pressures of emergency work. We're also going to have an urgent treatment centre which will see a large proportion of patients who currently attend the emergency department. So if we move to the next slide, this will give an overview of the Poole site. We're just going to show another short video.
I'm Dr. Isabel Smith, and I'm a consultant anaesthetist and medical director for strategy and transformation at University Hospitals Dorset. This brief animation shows the development of Poole Hospital's new theatres complex. The scheme will involve the demolition of existing temporary buildings and extending the existing hospital over 5 floors. We see the site compound being established and provision made to connect the existing hospital to the outer buildings during construction. You can see the demolition needed in red, with the removal starting in January. We then move swiftly into the build phase from early next year. As the video continues, we now move inside and you can see the fit out of the theatres, including a large open plan barn theatre. Overall, we'll have 15 theatres on 2 surgical floors, some newly built, others having major refurbishment. The project is part of an overall £250 million reorganisation of NHS services across Dorset, which will see Poole Hospital becoming the main centre for planned care in East Dorset, whilst at the same time the Royal Bournemouth Hospital becomes the centre for emergency care. As well as the new theatre complex, the project includes developing a new urgent treatment centre, expansion of our outpatient, cancer and diagnostic services, as well as the addition of a new community hub. The construction work has started with overall completion planned for early 2023. For more...
Thanks, Steve. So we're just going to move on to the next slide now, and we have a further video which just gives a bit more detail of our new theatre complex. So this is Paul Pavlou, who is our clinical director for orthopaedics. So he's an orthopaedic and trauma surgeon, and he's going to introduce our new theatres at Poole, including the barn theatres, which are a very innovative way of working, which we're embracing. Thanks, Steve.
Pavlou, and a consultant orthopaedic surgeon at University Hospitals Dorset. It's really exciting for all our staff to now see the enabling works have already started to create the new theatre block at Poole. This brief animation shows how we plan to develop the theatre department at the Poole Hospital site. This is part of the major £250 million transformation of our services at University Hospitals Dorset. These changes have been planned over the last 4 years with regular input from local clinicians and staff, contributing to design a modern theatre department. This conforms to new national standards, fit for the future needs of our local population in East Dorset and beyond. The existing buildings on the demolition footprint have already been demolished, and the site is now set up, ready for the construction of the 6-storey building. We start from Longfleet Road, moving along Parish Road, adjacent to St Mary's Church. The new 6-storey theatre block will be built onto the side of the hospital in the area previously occupied by Alma Lodge and adjacent to the pathology labs. This 6-storey building will support the 4 standard theatres on level 1 and a fully equipped 4-bedded barn-style theatre on level 2. As we enter the building on level 1, you can see a long corridor leading to each of the entrances to the 4 standard theatres. We enter a theatre through one of the anaesthetic rooms. Each theatre has its own anaesthetic room. The patient will be brought to the anaesthetic room adjoining the theatre where their operation will take place. An anaesthetic room presents the most satisfactory environment for a patient's calm and dignified preparation for surgery and the efficient and safe introduction of anaesthesia. We then enter one of the 4 standard theatres. Each standard theatre is 49 square metres, which is much larger than the existing theatres in Poole. These standard theatres will be used by gynecology and urology after the reconfiguration of the services in 2026. We then move up the corridor towards one of the prep rooms. Each theatre has its own prep room, and this is where the instrument packs and other sterile supplies for the day's operating list are delivered from the sterile goods area of the bulk store. The preparation room provides storage and suitable work surfaces for the laying up of instrument trolleys. We then enter another of the standard theatres. The scrub room is within a recessed area of each theatre and is where the staff scrub, gown and circulate concurrently without risk of contamination from each other or the surroundings. As we move around the theatre, you can see the various items of equipment such as microscopes, computer equipment and lighting required in a modern theatre environment. Next, we enter the dirty utility room, which is where clinical waste and laundry are disposed of safely. The dirty utility is shared by 2 theatres. We then leave the theatre and move back out into the corridor. There are very large windows at the end of the corridor to let in natural light. We then move up the stairs to level 2 into the main corridor to the theatre complex. We enter the barn theatre with its 4 operating tables via the dedicated anaesthetic room. Barn operating theatres are large, open-plan facilities where multiple operations can take place under individual ultra-clean air canopies. This theatre will be used for elective orthopaedic operations. The barn theatre is 220 square metres. That's almost the size of a tennis court. There are many benefits of a barn theatre. Open plan working has the potential to allow for enhanced team working. Expertise can be easily shared and intraoperative advice from colleagues easily sought. This has potential benefits in the training of non-consultant grade doctors. Surgeons in training can operate in parallel with their supervising consultant, allowing the opportunity for semi-independent operating with help and advice easily available. You can see there are very large windows allowing natural light into the theatre. Research has shown that natural light is of particular importance to the well-being of both patients and staff. Other benefits of a barn theatre include the potential to provide a high-quality working environment, as a large open space should provide a more airy environment with good natural and ambient lighting. It's also been suggested that shared working environments could lead to a greater awareness of contemporary surgical practice and optimise adherence to standards. We then go back out into the main corridor, walking towards the sterile store and prep room, which is shared by the 4-table barn theatre. Storage in the preparation room requires special consideration. Staff, sometimes under pressure, must be able to easily locate a required item. We enter the barn theatre again and move towards the scrub room, which is shared by 2 theatres. We then go back into the barn theatre. As we move through the barn theatre, you can see this is a state-of-the-art facility with the latest clean air and laminar flow technology to help us prevent infection. We exit the barn theatres through the dirty utility, which is shared by the 4-table barn theatre, and go back into the corridor. We now exit the building onto the roof, where you can see the view of St Mary's Church.
For more information on this development and the future plans for University Hospitals Dorset, visit the Investing in Our Hospitals section of our website.
Okay, so back with me for a few slides. So I'm just going to briefly talk about across UHD, we are not a single site, as we've talked a lot about Bournemouth and Poole, but I also wanted to make note that we are not a single site trust, and therefore Christchurch is also part of our ambitious plans. Whilst it's a taster of the great things that we'll be delivering over the next 3 years, we're also going to be working on a charity funded Macmillan unit at Christchurch, as well as options that we're looking at to explore senior living closer to the or within the community, and affordable shared housing as well. I wanted to then move on to the green agenda and sustainable construction. So this is one of the big things. Green's at the core of UHD and can be found in our green in our sustainable strategy, which was launched earlier last month and can be found on our website. But within construction, we're also driving the green agenda, and within that is generally driven through something called modern methods of construction and aiming for net zero carbon. So that's the acronyms. Modern methods of construction is where the industry aims for repeatable, standardized space that can be generally developed off-site, and therefore it's in an environment that is both clean, efficient, but also allows kind of standardized components and other things to be used. So when we developed Poole Theatres and the new building at Bournemouth, we've managed to achieve over 2/3 of our building is modern methods of construction, which is all around this repeatable, standardized design. And that's also one of the criteria as we step into something called the New Hospitals programme. I think it can sometimes refer to as Boris's 40 hospitals, but the new hospital investment. And when you step into that, there are some criteria we have to meet, one of which is all around the green agenda and meeting certain levels of modern methods of construction and net zero carbon. And that's absolutely in our goals. So that brings us on to the new hospital programme and what's next for Dorset. So we mentioned earlier that Dorset was one clinical services review, and we know that. And actually, because we've got that within the integrated care, the ICS, we've got a kind of join up between all of our foundation trusts and the CCG, and we've presented ourselves as one system. And because of that, we've got 5 of the new hospitals. So we've got Dorset County Hospital, we've got Poole Hospital, we've got St Anne's being developed for mental health, we've got Bournemouth Hospital, and then we've got the Community Christchurch, Community Hub in Christchurch. And all 5 of those are in what are called the fast and agile schemes for the new hospital programme. So our system covers all aspects of health and integrated health and social care. But that's not the end of our aims. We did have plans for Wimborne, Shaftesbury, Sherborne, and we still plan to develop those, and they're part of another second part of investment that we've put forward through an expression of interest to be part of any future wave of investment in this area. We've got a proven track record of delivery, so we know that we can bring capital into the Dorset system. We've got a great team who can spend that money wisely, work together to make sure we build efficiently, and we hope that the additional 6 schemes will also follow in due course. So I'm going to hand back to Isabel to talk about our innovation work.
Sorry, muted. Thanks, Steve. So talking about our work with partners and really looking at different ways of doing things, we know that innovation is at the heart of how we provide quality of care in this rapidly changing world. And I'm really pleased that we've been selected from over 80 hospitals who applied to create an innovation hub in Dorset. And this is supported by the Howe Foundation, which is a charity. This will focus on progressing proven innovations adapted to our context. So it's work we were going to do already, but supported with the Howe Foundation funding and technical support from the Innovation Unit through the Howe Foundation. This will help us work. If you just move on to the next slide, it shows the partners involved in the Innovation Hub. And our strategic aim is to work across the system in Dorset to embed a culture which enables, encourages and supports adaptation, adoption and spread of innovation. So we're working together at the moment to define our priority projects which will meet the needs of our population and deliver improvements in patient care across the system. And the Howe Foundation and Innovation Unit will work with us to strengthen our existing plans, share our excellence with other hubs and measure our impact. If you move on to the next slide now. Thank you so much for listening to us today. I hope this has given you a good overview of the way in which we're transforming services within our trust and alongside partners to improve care for our patients.
There are some questions, Steve, if you want to look in the chat bar that I was hoping you could answer.
Okay. Let me just bring that up, Jamie. So hopefully I've stopped screen sharing and you should be able to see me now then. Let me have a look, show conversation.
It's in the Q&A, the question marks on the top right.
Shall I answer the barn one, Jamie, if you want to come to me for that one, the first one I can see.
Yeah, do you want to take that one, Isabel, while I just bring it up?
Thanks, Jamie. So we're looking at the questions now. There's a question from somebody saying, with all the questions about infection prevention control, are barn theatres a good idea? There's a really good question. We know that barn theatres do exceed infection prevention guidance, and we've had our infection control team check over the barn theatres both before COVID and also in the context of the COVID pandemic. So as an anaesthetist, I don't have concerns that there would be infection control issues. I do think that it really lends itself to collaborative working, teaching, training and patient safety, as Paul described earlier in the video. We do have some information about that, which we may be able to share within our website as well. I might hand back to Steve to the how do you ensure you keep to budget?
Thank you. Okay, are we back with me? So yes, thank you for these questions. So how do you ensure we keep to budget? So we have so there's a few things really. We have got something called a guaranteed maximum price. So the contract that we have, very simply, is it's a new engineering contract, which is a type of construction contract that we've chosen to go with. And that has the process we have, or the framework we're on, has something called a guaranteed price that the partner, construction partner, IHP, Integrated Health Partners, have guaranteed to build our scope for that price. We also have some contingency and risk pots that we have separately to that, which are held by the trust over and above that for scope variation, changes as a result of COVID or other things that have come in. And then we monitor that absolutely. It's fully open book, so the work that we then have with our contractors is open book, and we're able to see absolutely every penny they spend, what it's on, where the variations is, where anything goes over. So it's a very transparent contract, and I think we're managing it really well. I think it's a great project, a great framework, and we would probably look to use it again, absolutely. The next question seems to be on how will you ensure that current patients do not suffer because of the huge development works that you've outlined. So this is part of our challenge around phasing and trying to make sure that we have the right number of beds in the right place at the right time. So we're obviously doing some really innovative work. I'd encourage you to look at, anyone watching, to look at the work that we're looking at around Think Big, and that's about the outpatients investment and the work we're looking to put into the community. So we're looking at really innovative work anyway, and we're kind of one of the few areas in the country that are looking to kind of drive that kind of change. So that keeps our patients flowing in through the door. We're also trying to kind of set this up because by splitting the planned and the emergency care, we then don't have patients suffering from any delays or cancellations because we have a dedicated stream in pool for our planned work, and the emergency work will all then go to Bournemouth in the future. The question about parking, will staff still be able to park on visitors? Yes. We will have a one-way system around the site for a period of time, so I'd encourage any visitors just to familiarise themselves, and that's also on the Investing in Our Hospitals website. The parking provision is still there, so we've moved, a number of our staff have moved into areas that are adjoining the hospital to make sure that we both keep the staff close but also give opportunity for visitors to still park. And for anyone arriving on public transport, we are also going to have electric golf buggies that will be running around the site, driven by our volunteers, that will take people around the site, pick up at the bus area and then take people around the site as well. The buildings look great, but will you have enough staff for them? I think that's one of the challenges we laid out at the beginning, and I might come to Isabel in a minute briefly, but I think it is an absolutely, it's one of the system challenges is the shortage of workforce, and the reason that we're making these changes is by aligning our staff into different areas and having people working what we're calling to the top of their license, everyone doing to the best they can, or as much as they can. Then actually we hope to address that, but also we do have some staff shortages, and it was really great news this week. We heard from our Director of Nursing, our Chief Nursing Officer, that we've got 200 new staff starting in the nursing department. So all of this is really good news for Dorset, and I think what we're trying to sell is that Dorset is a great place to live and work, and please come and join our teams for anyone who happens to be watching this outside of the Dorset area. Please assure me that all taps and hand washing will be mixer taps. Correct. So that's been part of our infection control. So infection prevention control have been part of all of our design work right from the start and have been involved in all of those. So yeah, I can absolutely assure that the designs have gone through and been signed off by both our Chief Nursing Officer and by the infection prevention control team. And how do your plans fit in with the local hospitals, such as Dorset County? So actually, I'm one of my other hats, so I'm the Transformation Director for UHD doing this work, but I'm also the Programme Director for the New Hospitals Programme, which is the partnership between ourselves, Dorset County and Dorset Healthcare, overseeing and coordinating the alignment of Dorset County and Dorset Healthcare as well. So we've been working collaboratively as a system to make sure that we lead with that. And actually within the new hospital programme, Dorset County is the lead prioritised programme. We decided as a system that Dorset County should be prioritised for their new ED and critical care unit that they're building. So that's kind of the best part of £70 million that's now going into the Dorset County Hospital. So Jamie, I think that's all the questions. I can't see any more that have come in unless I need to refresh, but I'll pause with that for the moment, unless there's anything. Isabel, did you want to come in on workforce?
I've got a couple of things to add, yeah. I don't know if you can come back to me. Thanks. So just a couple of extra comments on those questions. I think going back to the question about maintaining current patient safety, all of our plans have a very strong governance behind them. So the plans are made by the clinical teams and then go through our governance process, and ending with a clinical assurance group chaired by our Chief Medical Officer. And all of our plans have patient safety and quality at the heart. So at each stage, we're looking at providing really the best service to our patients as we phase the plans. And as Steve said, there's a lot of work going into looking at making sure we can provide the right number of beds, theatres and wards at each stage. But it is a complex project. And going back to workforce as well, that is a significant problem for us. Whether or not we make changes, it's a significant problem. As Steve said, these plans aim to improve that situation somewhat, but we're also looking at lots of different ways of providing our workforce. We have not just doctors and nurses, obviously, we have a lot of allied health professionals, and we have a clinical lead for the allied health professionals that is also contributing to all these plans and looking at other ways of utilising staff so that we're all using the most effective way for our patients. And going back to the TAPs, all of the plans, there's guidance in the way that new builds are built for the NHS, and obviously we are following them. Thanks, Jamie. If there's any others.
Brilliant. I think there's no more questions. So I just want to take the opportunity to thank you both so much for giving up your Saturday, for doing this, such an important story to tell, and to emphasise to everyone, please do look at our website, keep up with the news that's happening. We're really proud of everything that's going on, but we also want to make sure that we're engaging and telling people about what's going on, because it's really important that people know what these changes mean, how they're going to affect people, and how it's to the benefit of our region. So I think we can, no more questions come through. So just to thank you both again for coming today, and thank you all those joining on the call. Really appreciate it, and enjoy the rest of the open day. Thank you so much.